All right, let's dive deep today. We're talking cirrhosis of the liver. Pretty serious stuff, huh? We got some medical training materials, the kind doctors actually use, and wow, it's like detective work figuring this stuff out.
Yeah, it's more than just, the usual suspects everyone thinks of when they hear cirrhosis.
Exactly.
And it's not just about scarring either, though that's a big part of it.
Right, right.
It's about how that scarring messes up the liver's whole structure, how it works,
Yeah.
function.
And the liver is kind of vital, wouldn't you
Yeah,
say?
absolutely. Essential organ.
Essential for staying alive, whole deal.
Mm.
But the source material, it talks about these big three causes of cirrhosis in the UK, and one of them honestly surprised me.
Hmm. Let me guess. Are you talking about non-alcoholic fatty liver disease?
Yeah, that's the one. Didn't expect that to be so high up there.
It's become way more common, unfortunately, really tied to things like, well, obesity and diets full of processed food, sugar, all that.
Yeah, stuff a lot of us are dealing with, I'm sure.
Sadly, yeah.
Kind of a wake-up call. But what's even crazier is there's this whole other list of causes, not as common, but doctors got to look out for them.
Oh, yeah, absolutely. Got to keep the whole picture in mind.
We're talking hemochromatosis, Wilson's disease,
Hmm?
alpha-1 antitrypsin deficiency. I mean, some of these sound like movie villain diseases.
Right. Like straight out of a medical thriller.
But they're real, and they show just how complicated this diagnosis can be.
Oh, absolutely. It's rarely straightforward, that's for sure. Like, take hemochromatosis, for example. It's
Yeah.
genetic, right? Your body absorbs too much iron, and that iron builds up in your liver.
Oof, not good.
Not good at all. It damages it over time. And the tricky part is the symptoms can be all over the place. Some people get joint pain, others are super tired all the time, some show the liver problems right away, others, it takes a while.
So it's really like detective work, huh? Piecing together the clues.
It is. You got to look at the whole picture, the patient's history, their symptoms, run tests. It's a process.
Speaking of clues, what kind of signs would make a doctor suspect cirrhosis? Besides the stuff we usually think of with liver problems.
Well, there are some visual cues that can be pretty telling. Ever heard of parotid swelling?
Parotid swelling, can't say I have.
Yeah, the source material mentions it. It's basically when your parotid glands, those salivary glands right in front of your ears,
Hmm.
get swollen.
Huh, interesting.
And believe it or not, it could be a sign of alcohol-related cirrhosis. It's not that alcohol directly attacks those glands, but years of heavy drinking can lead to fatty deposits building up there, just like in the liver.
Wow, so it's like our body's sending out these little signals, these hints.
Exactly. And it's up to the doctor to decode them.
That's fascinating. What other kind of unexpected clues are there?
Well, there are these things called spider nevi, which are these tiny blood vessels that can appear on the skin, usually above the waist.
Spider Navy, huh?
They look like little spiders, hence the name. It's thought to be because of, like, hormone changes when the liver's not working right.
So you could be looking at someone's skin and get a clue about their liver.
You could, yeah. But it's important to remember these signs, they don't always mean cirrhosis. And they can have other causes too. But they definitely raise a red flag for a doctor to investigate further. And then there's the more obvious sign of ascites. That's when fluid builds up in the abdomen, makes it look swollen.
Yeah, ascites. Not just uncomfortable either, right? That's a sign things are getting serious.
Oh, absolutely. Severe ascites can make it hard to breathe, because it's pushing up on the diaphragm. Can even mess with your heart function. Sometimes doctors have to drain the fluid, but it's usually just a temporary fix.
And then there's this term in the source material, caput medusae. It sounds kind of scary, and apparently it's not a good sign visually.
Yeah, that's a striking one. So when you get this network of engorged veins around the belly button, like imagine the head of Medusa with all those snakes. It's rare, thankfully, but it means there's really high blood pressure in the vein that carries blood to the liver. Portal hypertension, they call it.
It sounds like a whole other layer of problems on top of the cirrhosis itself.
It is. It's a complex condition with a lot of moving parts.
So it's like a puzzle, right? Doctors have to look at the patient's history, the symptoms, these visual clues. Then they use blood tests and imaging to try and get a clearer picture.
Exactly. And even then, it's not always crystal clear. There's a lot of individual variation,
All right.
But once they've confirmed it's cirrhosis, the focus shifts to figuring out how severe it is and how it's affecting the rest of the body, because it can have a real domino effect.
Domino effect. That doesn't sound good. What do you mean?
Well, for one, cirrhosis makes you way more likely to have internal bleeding.
Hmm.
We're talking about something called variceal hemorrhage. That's when enlarged veins in the esophagus or stomach, called varices, rupture. They're like ticking time bombs.
Yikes, that's terrifying. How can doctors even try to prevent that?
They do this procedure called gastroscopy, where they basically put a camera down your throat to look at the esophagus and stomach.
Oh, fun.
Not the most pleasant experience, I'll admit, but it lets them see those varices. If they find ones that look risky, they can sometimes strengthen them with banding.
Banding.
Yeah.
Like using rubber bands.
Yeah, pretty much. Sounds simple, but it can really work to prevent life-threatening bleeding.
Wow, that's wild. But the complications don't stop there, do they? Cirrhosis can also lead to that fluid buildup in the abdomen we talked about, ascites.
Right, we touched on that earlier. But it's important to remember, it's not just discomfort. In serious cases, ascites can make it tough to breathe, put pressure on your diaphragm, even mess with your heart. Doctors often use fluid restriction and diuretics, meds, to help the body get rid of excess fluid. But
So basically making you pee more.
pretty much, yeah. But it's a way to manage the fluid buildup, try to lessen the strain on the body.
I remember you mentioning caput medusae earlier. Sounded pretty ominous.
It is a striking sign. It's basically a network of engorged veins around the belly button, like, think Medusa from mythology, with all those snakes. Thankfully, it's rare, but it points to severe portal hypertension, meaning really high blood pressure in the vein that brings blood to the liver.
So it's a whole other layer of issues on top of the cirrhosis itself.
Exactly. It gets complicated quickly.
So it's a real puzzle then, huh? Doctors got to consider the patient's history, all these symptoms, visual clues, and then use blood tests and imaging to try and get a clear picture of what's going on.
Exactly. And even then, it might not be totally straightforward. Every case is a bit different. But once they know for sure it's cirrhosis, the focus shifts to figuring out how bad it is and how it's affecting the rest of the body, because it can have this domino effect, you know?
Domino effect, huh? That doesn't sound good. What do you mean by that?
Well, for one thing, cirrhosis really increases the risk of internal bleeding. Like, there's this thing called variceal hemorrhage, which is when those enlarged veins in the esophagus or stomach, the varices, they rupture. Yeah. And they're basically like ticking time bombs, you know?
Oh, wow. That's scary. How do doctors even try to prevent something like that?
They can do a procedure called a gastroscopy, where they basically put a camera down your throat to look at the esophagus and stomach.
Oh, sounds pleasant.
Not the most fun experience, I'll admit, but it lets them see those varices, and if they find ones that look dangerous, they can sometimes strengthen them with something called banding.
Banding, like using rubber bands.
Yeah, pretty much. It sounds kind of strange, but it can actually be really effective at preventing life-threatening bleeding.
Wow, that's amazing what medical science can do these days. But it sounds like the complications don't stop there. Cirrhosis can also lead to that fluid buildup in the abdomen we talked about earlier, ascites.
Right, we touched on that before. It's important to remember it's not just about discomfort. If it gets bad enough, you can make it tough to breathe because it's pushing up on the diaphragm, and it can even mess with your heart function. Doctors often try things like fluid restriction and diuretics, medications that help the body get rid of that extra fluid.
So basically making you pee more.
Essentially, yeah. It's about managing that fluid buildup and trying to, reduce the strain on the body.
And then there's hepatic encephalopathy. That's the brain dysfunction we were talking about before, right? That sounds pretty serious.
It is. Basically what happens is when the liver's so damaged it can't filter toxins from the blood properly, those toxins can build up and reach the brain. Causes all sorts of problems.
So your liver failing can literally mess with your mind.
It can, yeah. It often starts with mild confusion, forgetfulness, trouble concentrating. But in severe cases, it can lead to personality changes, disorientation, even coma.
Wow, I'm starting to understand why this is such a serious condition.
Yeah, it's nothing to mess around with. And one of the ways doctors check for this hepatic encephalopathy is with something called the star drawing test. They literally have the patient try to draw a 5-pointed star.
Really?
Yeah. People with hepatic encephalopathy, they often have trouble with it because their fine motor skills and spatial reasoning get messed up.
That's both fascinating and scary at the same time. So we've got bleeding, fluid buildup, brain dysfunction. It sounds like cirrhosis really does affect the whole body.
It does. It can also weaken the immune system, making people more susceptible to infections, and it can mess with blood clotting, making even minor injuries more serious. It's like a cascade of complications.
And I imagine the prognosis isn't great once you reach this stage.
It really depends, depends on the cause, how advanced the cirrhosis is, things like that. Doctors use these scoring systems, like the Child-Pugh score and the MELD score, to kind of assess the severity and predict how things might go.
Yeah, I remember seeing those mentioned in the source material, but I didn't really get what they meant.
Think of them like ranking systems. They take into account all sorts of factors: bilirubin levels, albumin levels, ascites, encephalopathy, how well the blood's clotting. The higher the score, the more severe the cirrhosis, and the worse the outlook.
So it's like a way to gauge how serious things are.
Exactly. And understanding these scores can be helpful for patients because it gives them a better idea of what they're dealing with, helps them make informed decisions about their care.
That makes sense. Knowledge is power, right? But what about treatment? Is there anything that can actually reverse the damage?
Unfortunately, no. Cirrhosis is generally considered irreversible. That scar tissue in the liver, it's permanent. But that doesn't mean there's nothing doctors can do.
Okay, so what can they do?
Well, the first thing is to try to stop the damage from getting worse. So if it's alcohol-related, that means stopping drinking completely. If it's a medication side effect, they might need to adjust the medication or stop it altogether. And for things like viral hepatitis, there are antiviral drugs that can help manage the infection.
So stop the bleeding, so to speak.
Exactly. Try to contain the damage. But what about all the damage that's already there? The scarring, the complications. Can those be reversed?
Yeah, that's what I was wondering.
Unfortunately, no. Like I said, cirrhosis is generally considered irreversible. That scar tissue, it's there to stay. But that doesn't mean treatment is hopeless. The focus shifts to managing the symptoms and preventing further complications, trying to improve quality of life, and potentially prolong survival.
So it's more about damage control at that point.
Exactly. And there are a number of ways doctors can do that. For example, for ascites, they might restrict fluid intake and prescribe diuretics, those medications that help the body get rid of extra fluid.
So basically make you pee more.
Pretty much, yeah. But it's a way to manage that fluid buildup and try to reduce the strain on the body.
Makes sense. And for those varices, those enlarged veins, I remember you mentioned a procedure called banding.
Right, that's where they place tiny rubber bands around those veins to strengthen them and make them less likely to bleed.
It's amazing what they can do these days. What about hepatic encephalopathy, that brain dysfunction? Any effective treatments for that?
There are, yeah. There are medications that can help reduce the buildup of toxins in the blood, and dietary changes can sometimes help too. For example, limiting protein intake can sometimes make a difference, which might seem counterintuitive because we think of protein as being good for us.
But yeah, why protein? I thought that was supposed to be a good thing.
It is, generally speaking.
All right.
But for people with severe liver damage, their body can have trouble processing protein properly, and those byproducts can actually contribute to the buildup of toxins that affect the brain.
Oh, wow, I didn't know that. So it's a really delicate balance then.
It is. It's not just about treating the liver in isolation. You have to consider how everything's connected.
So it sounds like there are tools available, but it's still a tough battle. What happens when those standard treatments aren't enough?
Well, for really severe ascites that doesn't respond to diuretics, doctors might have to do a procedure called paracentesis. Basically, they insert a needle into the abdomen to drain the fluid directly.
Oh, wow.
It can provide some relief, but it's not a permanent solution, and it can be pretty uncomfortable for the patient.
I can imagine. And you mentioned a TIPS power procedure earlier, which sounded pretty intense.
It is. It's usually reserved for cases of severe portal hypertension where other treatments hasn't worked. They basically create a shunt, a new pathway for blood to flow through the liver to try and reduce pressure in the portal vein. It's an interventional radiology procedure, so it's done using imaging guidance, but it does carry some risks.
Sounds complicated.
It is. And of course, there's always the option of liver transplant, but
The nuclear option, as they say.
yeah, in a way, it can be life-saving for people with end-stage liver disease, but
Yeah.
it's major surgery, long recovery. And it's not an option for everyone. There's a shortage of donor livers, and not everyone's a suitable candidate for a transplant. There are strict criteria based on overall health, age, other medical conditions. It's a last resort, really.
This has been eye-opening, to say the least. I feel like I have a much better understanding of what cirrhosis is, how it develops, and just how serious it can be.
That's great to hear. It's important to be informed.
And speaking of informed, there was one thing in the source material that really stood out to me. It talked about how in cases of alcoholic cirrhosis, doctors are trained to look for other signs of alcoholism during the examination.
That's a really good point. It highlights the importance of taking a holistic approach to healthcare.
Yeah.
It's not just about treating the immediate problem, but also considering the underlying causes and any other conditions that might be going on.
Right. It's like if someone is drinking enough to damage their liver, there's a good chance there are other things going on too, other health problems that might be connected.
Exactly. Alcoholism can affect almost every system in the body. It's not just about the liver.
So, what are some of those, let's call them hidden dangers of excessive drinking? Things people might not even realize are connected to alcohol.
Well, we talked about cardiomyopathy earlier, that weakening of the heart muscle. But alcohol can also contribute to high blood pressure, stroke, and even certain types of cancer, including breast cancer, colon cancer, and liver cancer.
Wow, that's a lot to consider. And I imagine it can take a toll on mental health as well, right?
Absolutely. Alcohol is a depressant, so it can make symptoms of anxiety and depression worse. And long-term heavy drinking can lead to cognitive decline, memory problems, even dementia.
So, we've officially debunked the myth that alcohol is only bad for your liver.
Right, it affects the whole body.
It's a powerful drug with widespread effects, and it's important to treat it with respect.
Couldn't agree more.
So, if someone is concerned about their drinking, what should they do?
The first step is to talk to their doctor. They can assess their drinking habits, provide guidance, and recommend resources for support.
And there are resources out there, right? Like support groups, therapy.
Absolutely. There are lots of different approaches to addressing alcohol dependence, and what works best is going to vary from person to person. But the most important thing is to reach out for help if you need it. There's no shame in asking for support.
Well, this has been a sobering conversation, to say the least.
I see what you did there.
Couldn't resist. But in all seriousness, I think it's important to have these kinds of conversations to bring these issues out into the open. Because the more we understand about the risks, the better equipped we are to make healthy choices for ourselves and the people we care about.
I completely agree. Knowledge is power. And when it comes to our health, knowledge can truly be life-saving.
Okay, well, I think we've covered just about everything there is to know about cirrhosis, and then some. We've talked about the causes, the symptoms, the complications, the treatment options.
And we've touched on the wider implications of alcohol use and the importance of seeking help if you need it.
Exactly. But I think what's so striking about these medical training materials is how they really emphasize looking at the whole picture.
Uh,
Like they mention that if a doctor suspects alcoholic cirrhosis, they should also be on the lookout for other signs of alcoholism during the examination. It really underscores the fact that everything is connected.
It's a reminder that we can't just treat the immediate problem in isolation. We have to consider the underlying causes and the potential for other conditions that might be present as well. After all, if someone's drinking habits are severe enough to damage their liver, chances are other systems are being affected too.
Absolutely. And it makes you wonder, what other hidden health issues might we be missing because of common but often overlooked causes?
That's a really thought-provoking question.
Yeah.
And it speaks to the need for a more holistic approach to healthcare, one that takes into account all aspects of a person's life, not just their physical symptoms.
Well said. But getting back to cirrhosis specifically, we've talked about the causes, the complications, and the, frankly, sometimes pretty grim prognosis.
Hmm.
But what about treatment? What can doctors actually do once someone has been diagnosed?
Well, as we touched on earlier, the first and most important step, whenever possible, is to address the underlying cause. So if it's alcohol-related, that means stopping drinking completely. If it's a medication side effect, they'll need to either adjust the medication or discontinue it. And for things like viral hepatitis, there are antiviral drugs that can help manage the infection.
Okay, so that makes sense, right? Halt the damage, put out the fire, so to speak. But what about all the damage that's already been done? The scarring, the complications, can those be reversed?
Unfortunately, not really. Cirrhosis is generally considered irreversible. That scar tissue that forms in the liver, it's permanent. But that doesn't mean treatment is futile. The focus shifts to managing the symptoms and preventing further complications, trying to, improve quality of life and potentially prolong survival.
So it's more about slowing the progression and making people as comfortable as possible?
Exactly. And there are a number of different strategies that doctors use to achieve that. For example, for ascites, they might recommend limiting fluid intake and prescribe diuretics, which are medications that help the body get rid of that excess fluid.
So they're basically trying to manage the fluid buildup and reduce the strain on the body.
Precisely. And for varices, those enlarged veins that are at risk of rupturing, they might use a procedure called banding. It involves placing tiny rubber bands around those veins to strengthen them and reduce the risk of bleeding.
Wow. It's amazing what medical science can do, isn't it? But what about hepatic encephalopathy, that brain dysfunction we were talking about? Are there any effective treatments for that?
There are, yeah. Medications can be used to reduce the buildup of toxins in the blood, and dietary changes can also make a difference. For instance, limiting protein intake can sometimes help, which might seem counterintuitive, because we tend to think of protein as an essential nutrient.
Yeah, why would limiting protein help? I thought that was supposed to be a good thing.
It is, generally speaking, but in people with severe liver damage, the body has trouble processing protein properly, and those byproducts can actually contribute to the buildup of toxins that affect the brain.
Oh, interesting. I didn't know that. So it's a really delicate balancing act then.
It is. It's not just about treating the liver in isolation. You have to think about how everything's connected.
So it sounds like there are tools in the toolbox, but it's still a pretty tough uphill battle. What happens when those standard treatments aren't enough?
Well, for really severe ascites that doesn't respond to diuretics, doctors might have to perform a procedure called paracentesis, where they insert a needle into the abdomen to drain the fluid directly.
Oh, wow. That sounds intense.
It can provide temporary relief, but it's not a permanent solution, and it can be uncomfortable for the patient.
I can imagine. And I remember you mentioning a TIPSES procedure earlier, which sounded pretty intense as well.
It is. It's usually reserved for cases of severe portal hypertension when other treatments haven't been successful. It involves creating a shunt, basically a new pathway for blood to flow through the liver, to try to reduce the pressure in the portal vein. It's an interventional radiology procedure, so it's done using imaging guidance, but it does carry its own set of risks.
It's almost like a last resort before considering a liver transplant.
Yeah, it can be seen that way. And of course, a transplant is the ultimate treatment option, potentially offering a second chance at life for people with end-stage liver disease.
But as we discussed before, transplants aren't always an option.
Right. Donor livers are in short supply, and there are strict criteria for who's eligible for a transplant based on things like overall health, age, and other medical conditions. It's a complex decision, and there's a long recovery period involved.
It's a reminder that we shouldn't take our health for granted. But shifting gears for a moment, I was struck by something else in the source material. It mentioned that in cases of alcoholic cirrhosis, doctors are trained to look for other signs of alcoholism during the examination.
That's a good point. It's another example of how doctors are trained to think holistically. They're not just focused on the liver, they're considering the bigger picture of the patient's health and lifestyle.
Because, let's face it, if someone is drinking enough to damage their liver, there's a good chance they're probably not prioritizing their health in other areas either.
Exactly. And those choices can have a ripple effect throughout the body.
So let's talk about those ripple effects. What are some of the lesser-known health consequences of excessive drinking? Things that people might not even realize are connected to alcohol.
Well, aside from the liver damage we've been talking about, excessive alcohol use can really wreak havoc on the cardiovascular system. It can contribute to high blood pressure, weaken the heart muscle, which leads to cardiomyopathy, and even increase the risk of stroke.
That's a pretty sobering thought, literally. And I know alcohol is linked to certain cancers, but I'm curious to know more about the specifics.
Sure, alcohol consumption is a known risk factor for several types of cancer, including breast cancer, colon cancer, esophageal cancer, and of course, liver cancer. And the more you drink, the higher your risk.
It's unsettling to think about, and I imagine excessive drinking takes a toll on mental health as well, right? I mean, alcohol is a depressant after all.
Absolutely. It can worsen symptoms of anxiety and depression, and in the long term, it can contribute to cognitive decline, memory problems, and even dementia. Alcohol really can affect every aspect of a person's well-being.
It's a stark reminder that moderation is key, isn't it? But for someone who's concerned about their drinking, what's the first step toward getting help?
The most important step is to talk to their doctor. They can help assess the situation, provide guidance, and recommend appropriate resources for support, whether that's therapy, counseling, or support groups.
And there are resources out there, right? People don't have to go through this alone.
Absolutely. There are many different approaches to addressing alcohol dependence, and what works best will vary from person to person. But the important thing is to reach out for help if you need it. There's no shame in asking for support.
I think we need to normalize these conversations and break down the stigma surrounding addiction and alcohol dependence. It's a health issue, just like any other.
I couldn't agree more. Open and honest conversations can be incredibly powerful, both for individuals who are struggling and for society as a whole.
Well, we've covered a lot of ground today, haven't we? We've explored the intricacies of cirrhosis, the challenges of diagnosis and treatment, and the far-reaching consequences of excessive alcohol use.
And we've touched on the human side of things a bit, the importance of getting help if you need it, support systems, all that.
Exactly. But what really struck me about these materials, these training things for doctors, is how they stress looking at the whole person. Like, they say if a doctor suspects alcoholic cirrhosis, they got to be checking for other signs of alcoholism too, not just the liver stuff.
Right. It's not just about one organ, it's about the whole system.
Yeah, exactly. It really makes you think, like, what other health problems are we missing because we're not always looking at the big picture?
Hmm. That's a good question. Makes you think about how we approach healthcare in general.
For sure. But getting back to cirrhosis, I guess. We've talked about the causes, the complications, how serious it can get. But what about treatment? What can doctors actually do once someone's diagnosed?
Well, like we mentioned earlier, the first thing, whenever possible, is to deal with the root cause, right? So if it's from alcohol, that means quitting drinking completely.
Makes sense?
If it's a side effect of some medication,
Yeah.
got to adjust that or stop it altogether. And for things like viral hepatitis, there are antiviral drugs to help manage the infection.
Right, so stop the problem at the source if you can.
Exactly. Contain the damage. But then there's the damage that's already done, the scarring, the complications. Can those be reversed?
Yeah, that's what I was wondering. Is there any going back from that?
Sadly, not really. Cirrhosis is usually considered irreversible. The scar tissue in the liver, it's permanent. But that doesn't mean treatment's pointless. The goal then becomes managing the symptoms, preventing things from getting worse, trying to improve the person's quality of life, maybe prolong their survival.
So it's more like damage control at that point.
Exactly.
Yeah.
And there are a few ways doctors can do that. For ascites, for example, they might limit how much fluid the person drinks and give them diuretics.
Diuretics, those are the water pills, right? Make you pee more.
That's the one. Helps the body get rid of that excess fluid.
So basically trying to manage that fluid buildup and take some of the strain off the body.
Exactly. And for those varices, the enlarged veins that can rupture, they might do a procedure called banding. Tiny rubber bands around those veins, basically, to make them stronger, less likely to bleed.
Man, it's wild what they can do these days.
It is, yeah.
What about hepatic encephalopathy, that brain stuff we talked about? Any treatments for that?
Yeah, there are some things they can do. Medications to reduce the toxins in the blood, and sometimes diet changes help too. Like sometimes limiting protein can make a difference.
Really? Why protein? I thought that was good for you.
It is, usually. But with severe liver damage, the body can't process protein properly, so those byproducts end up adding to the toxins that mess with the brain.
Huh. That's interesting. I didn't know that.
Yeah, it's all connected. It's a balancing act.
So it sounds like there are options, things they can try, but it's still a really tough situation. What happens when those standard treatments, they don't work anymore?
Well, if the ascite's really bad and those diuretics aren't helping, they might have to do a paracentesis.
Paracentesis, what's that?
Basically, they use a needle to drain the fluid directly from the abdomen.
Oh, wow.
It gives some relief, but it's not a permanent fix, and it can be uncomfortable for the patient.
Yeah, I can imagine. And you mentioned that tip PS procedure before, which sounded pretty intense.
It is. It's usually only for really severe cases of portal hypertension when nothing else has worked. They create a shunt, which is basically a new pathway for blood to flow through the liver to try to relieve that pressure in the portal vein.
Sounds complicated.
It is. It's done using imaging guidance, but it does have some risks too.
And then, of course, there's always the option of a liver transplant, but...
Yeah, that's kind of the last resort, isn't it?
Yep, the nuclear option.
In a way, yeah. Transplant can be life-saving for folks with end-stage liver disease,
Yeah.
but it's a huge surgery, long recovery, and it's not available to everyone. There's a limited supply of donor livers, and not everyone meets the criteria, health, age, other conditions. It's a complex decision.
Definitely makes you appreciate your health, that's for sure.
Absolutely.
Switching gears a bit, there was something else in these training materials that caught my eye. It mentioned that when a doctor suspects alcoholic cirrhosis, they're supposed to look for other signs of alcoholism too, not just the liver stuff.
Yeah, that's important. Doctors are trained to think holistically, not just focus on one organ or one problem.
Right, because if someone's drinking enough to damage their liver, chances are they're not exactly prioritizing their health in other areas either.
Exactly. And those choices can affect the whole body. It's all connected.
So what are some of those, like, hidden dangers of drinking too much, things people might not realize are connected to alcohol?
Well, besides the liver damage, heavy drinking can really mess with your heart and blood vessels. High blood pressure, cardiomyopathy, which is a weakening of the heart muscle, even stroke.
Wow, that's scary stuff. And I know alcohol's linked to certain cancers, but what are the specifics?
Well, drinking alcohol is a known risk factor for several types of cancer. Breast cancer, colon cancer, esophageal cancer, and of course, liver cancer. And the more you drink, the greater the risk.
It's pretty unsettling to think about, and I imagine excessive drinking affects mental health too, right? Alcohol is a depressant after all.
Absolutely. It can worsen anxiety and depression, and over the long term, it can lead to cognitive decline, memory problems, even dementia. It really can affect every aspect of a person's well-being.
It's a good reminder that, moderation is key, but if someone is worried about their drinking, what's the first step they should take to get help?
Honestly, the most important thing is to talk to their doctor. A doctor can help assess the situation, offer guidance, and recommend resources for support. Therapy, counseling, support groups, things like that.
And those resources are out there, right? You don't have to go through this alone.
Absolutely not. There are a lot of different approaches to addressing alcohol dependence, and what works best will vary from person to person. But the key is to reach out for help when you need it. There's no shame in that.
I think we need to do a better job of normalizing these conversations. Breaking down the stigma around addiction. It's a health issue, just like any other.
I agree completely. Open and honest conversations are so important.
Well, we've definitely covered a lot of ground today. We've gone deep into cirrhosis, talked about diagnosis, treatment, the effects of excessive drinking.
And we've talked about the human side of things, the importance of compassion and support.
Exactly. But what I find interesting is that while these medical materials we've been looking at, they give a ton of scientific info about cirrhosis, they don't really talk about what it's actually like to live with the disease.
You mean the emotional and social impact?
Yeah, exactly. It's one thing to understand the biology, but it's a whole other thing to experience it day in and day out.
Yeah, for sure. The physical discomfort, the emotional burden, how it affects relationships, your whole life. It's not something you see in textbooks a lot.
Right. And it's so important to remember behind every diagnosis, there's a real person with their own unique experience, their own struggles and triumphs.
Absolutely. And that person needs more than just medical treatment, right? They need compassion, understanding, a good support system.
So true. It's a good reminder that we need to approach healthcare with empathy. See the human being at the center of it all.
Couldn't agree more.
So while we've, really dug into the science and the medicine of cirrhosis, let's not forget about that human side of it.
Yeah, definitely a perspective that deserves more attention, both from the medical world and just like society in general.
Well said. One thing that kind of struck me reading through these training materials for doctors, they're very matter of fact when they describe alcohol-related problems. Very clinical, kind of detached.
I noticed that too.
Yeah.
While I get that, for training purposes, they got to be objective.
Yeah.
It's easy to lose sight of the human element, I think.
Yeah, for sure. It's easy to get desensitized when you're just talking about statistics and medical terms, but behind every case of alcoholic cirrhosis, there's a whole story, a whole life that's been affected by this disease.
Right, it's not just numbers on a page.
And so often it's not just about bad choices. There's genetics, social factors, personal experiences, trauma. It's complicated.
It really is. We need to have more compassion and understanding around these issues. Addiction is a disease, not a moral failing.
And that kind of brings us back to that stigma we were talking about earlier. The stigma surrounding alcoholism prevents people from getting help, and it makes it harder for their families to get support too. It's a vicious cycle.
It really is. We got to break down those barriers and create an environment where people feel safe to ask for help.
Okay, so wrapping up our deep dive on cirrhosis, I'm left with kind of mixed feelings, hope, because medical science is always advancing, coming up with new treatments, new possibilities, but also concern because this disease, it affects so many people.
Yeah, it's a tough one. No easy answers. But like we've been saying, knowledge is power. And hopefully these conversations can help raise awareness, maybe encourage prevention, and support the people going through this.
I think that's what we've tried to do today, explore the science, but also the human side of things. And hopefully our listeners are walking away feeling more informed, maybe a little more empowered, and definitely more compassionate.
I hope so.
Well, on that note, I think it's time to wrap things up for today. As always, remember this is just for informational purposes. If you have any concerns about your health, talk to your doctor. They're the real experts.
Couldn't have said it better myself.
Until next time, happy exploring, everyone. And take care of yourselves and each other.